Today we are talking about basic wound care when it comes to your sheep and goats. So this is very important, and this is going to be one of the basic things that you need to know about basic animal husbandry on your farm. Of all the things that are going to happen, the number one thing that you're going to run into, just everyday kind of occurrence that is simple and that you can fix before it becomes a bigger problem, is basic wound care. So today what we're going to do is we're going to go through some of the very, very basic stuff, and then we're going to wrap it up with a little bit of a larger issue that you may run into, and we'll kind of spread it all out and give you guys the best info we can. So stay tuned to find out more. Okay, so the basic stuff that you're going to run into, I'm going to try to keep this as short and sweet and to the point as possible. You're going to run into three basic kind of wounds on your farm. You're going to run into basic lacerations and cuts, where it breaks the skin, but it doesn't get too much down into the muscle. And then you're going to run into punctures, and this can be caused by thorns. This can be caused by sharp objects. And this is a deeper wound that actually penetrates either, into the muscle, into organs, things like that. And then lastly, the third one that you're going to run into is what we call like our complicated wounds. And complicated wounds tend to be kind of a mixture of all three or a mixture of two, which lead into a more complicated wound. And a lot of times this will end up forming like an abscess. And then you're getting into kind of the deep weeds of, what do I do with this? It's not simply just spray it down. This is going to involve drainage of abscesses, antibiotics, things of that nature. So first and foremost, whenever you run into a wound on your animal, this is important to monitor for. You want to be out on the farm every day. You want to visually inspect all of your animals every day, even if it's just casually. I'm not talking about getting them in and actually laying your hands on them, but you need to casually inspect your animals every day. You're going to watch for lameness. You're going to watch for limping. You're going to look for blood, things of that nature, wool missing, hair missing, the animal not acting themselves. And sometimes these wounds can be difficult to find, and you may actually have to look around. Now, when it comes to cleaning wounds, a lot of people like to go for the hydrogen peroxide up front, and hydrogen peroxide is fine. Hydrogen peroxide, kills bacteria, it kills a lot of nasty stuff. And it works really good, but I only want you using this initially. Hydrogen peroxide really doesn't care what cells it kills. It likes to kill a lot of different things. So when you actually pour hydrogen peroxide on a wound and you see that white fizzing, that is actually cells exploding, and it's oxygen that's being released because of those cells popping, essentially, is the easiest way that I can put it. So while hydrogen peroxide is really good for cleaning up front and initially, you don't want to be cleaning a wound daily with hydrogen peroxide because it's actually going to inhibit the healing process. So again, when it comes to hydrogen peroxide, use it first and foremost. It does a great job of cleaning, but it's not something that we want to use long term. Rubbing alcohol is the same way, works really good. And then our go-to favorite here on the farm is iodine, 7 to 10%. I like to use 10% iodine. Now listen, this stuff here will turn you as orange as an Oompa Loompa faster than you can say everlasting gobstopper. So unless you want to walk around looking like you just took a swim in a giant bag of Cheetos, I highly suggest you put some gloves on and some proper protective equipment, because once this stuff gets on you, you're going to be orange for a while. Does a great job of cleaning, does a great job of disinfecting, and we really like it. The go-to on the farm that I think you should have, that I really like the wound coat. It's just a purple spray. It's aerosol. You can shake it up. You can do from any angle. As you can see, when I spray it on here, it's just a nice purple color. Scarlex is another dressing, antiseptic, germicidal, fungicidal, works really good. And this is kind of a pinkish reddish color spray. Both of these equally good. For my wounds that I need more of, it's like kind of like oozy and weepy, I like to use the aluminum aerosol bandage. I feel like this really creates more of a protective barrier, and it kind of looks like spray paint, but you can see it there. And it really gets you, good. So, you know, these three sprays I kind of think of as, you know, cuts. Like I've got really basic general stuff like a laceration, doesn't need stitches, doesn't need staples, and I just want to make sure that I keep it clean. These do a great job of keeping things clean and keeping things aseptic, but they will not repel flies. If you do not have a bottle of Catron spray on your farm, I highly suggest that you get this. This repels and kills flies, ticks, mites, all kinds of things. Anytime during the warmer months where you have flies and gnats around and you treat a wound, you want to top dress that wound with your Catron spray. Kind of getting into some of the fancier stuff. This is Underwood horse medicine. This stuff is just fantastic. If you have a wound and you need it to heal, what you do is a couple times a day you take this Underwood horse medicine, you spray it on the wound, you take some baking powder and you top dress it with some baking powder. I don't know how it works or why it works the way that it does, but this stuff works really good. I happened to see one day, I was watching Dr. Pol on Nat Geo, and I happened to see he was using something and I couldn't tell what it was, so I froze the frame and I saw what he was using for a wound, and it was this stuff right here. So I bought myself a bottle, I started using it, and lo and behold, it works like a champ. This stuff's kind of pricey, but if I had to pick, you know, between these three or this, I would take this every day of the week. The problem is this is not nearly as easy to use as these. It's not nearly as user friendly. So that's something that I want you to keep in mind as well. So when we're looking at our wounds, that's kind of our basic wound care. When we're looking at our wounds, you need to inspect your wounds thoroughly. You need to make sure that there's nothing in there. If you have a laceration, or especially if you have a puncture, a lot of times there can be a thorn that's stuck in there, a piece of foreign debris that's stuck in there. You want to cleanse the wound thoroughly. You want to dress the wound thoroughly, address the wound thoroughly to make sure that there's nothing left in there. That's when we end up running into issues where we end up with abscesses. The other thing that I wanted to talk with you about is basic wound closure. If you need to close a wound, this is probably the best thing that you can get. This is a veterinary stapler. I am not going to show you how to suture today. This is quick and to the point. You can basically put this up against the wound and pull it, and it will put a staple in there. You'll have to come back in a few weeks and cut the staples out, but it really beats the alternative, which is putting sutures in an animal. I may do a video on suturing if you guys want me to, but I would recommend this. I'm also going to put the links to all of this stuff down in the comments section, or excuse me, in the description below. So make sure that you check that out. But staplers, way better than suturing. Other things that you are definitely going to want to keep on hand is going to be scalpels and larger syringes. I like my larger syringes, a 60 or a 50 ml syringe with a nice big needle. 14 gauge needles are nice if you have to address any kind of abscess. You can get abscesses where there is no wound. You can get large lumpy kind of wounds from bruising, hematomas, things like that, where maybe one animal gets hit by another and they swell up really bad and you have to actually relieve some pressure. So with that being said, you know, we've kind of addressed basic cuts. We've addressed punctures. Again, clean. That's important. I want you to dress those wounds every day for at least 7 days until they heal up. Don't pick scabs off. Don't do anything like that. You don't need to clean it and debride it every day. Just keep them clean. CD and T is important as well. Now I say CD and T because that's the Clostridium and tetanus, and usually sheep and goat people, that's the way that they go about it, is they give Clostridium and tetanus together. But what I want you to think of is this: tetanus is a issue that will kill your animals, and it does not need to. It is an absolute just awful thing if you lose an animal to tetanus, because it doesn't need to happen. If you're going to vaccinate your animals against one thing and one thing only, it would be tetanus. It's preventative and there's no reason for it. If your animal is not vaccinated against tetanus, you need to vaccinate them against tetanus. Tetanus is everywhere, and anytime you get an open wound in any of your animals, I want you to think tetanus. You should be giving tetanus boosters to your animals annually. I know with humans it's every 10 years. It's not that way with your sheep and goats. Go ahead and just give your tetanus booster annually. Ideally, just give it with your Clostridium all together in your CD and T, and you'll be fine. But again, if let's say you get an animal that gets wounded, any kind of wound, that would be ear tagging, tail docking, a puncture wound, a cut, a scrape, anything at all. If they are not vaccinated against tetanus, I want you to vaccinate them against tetanus immediately. If the animal shows signs and symptoms of tetanus, you can always give tetanus antitoxin as well. If you don't have tetanus antitoxin on hand, I would highly suggest that you get some. But if you're vaccinating, you don't need to, because they're going to be covered. So with that being said, I wanted to move on to one more advanced case. We have an individual sheep that is on our farm that has an abscess in her hindquarters. She was actually rammed by a aggressive male during breeding. He actually rammed her in her hamstring area, and it created a hematoma, which in turn turned into an infection, and now she has an abscess. So this is more advanced, and so I wanted to show you how to approach an abscess and how to deal with it. Before we start dealing with the abscess, I want to say this. If you've got a wound and it looks bad enough that you need to start cutting or draining, or it's down into the muscle, I also want you to think about antibiotics. General course here on the farm that we would run on a general animal would be 5 milliliters subcutaneous every other day of LA200, or 6 milliliters subcutaneously every other day of Nuflor, for a total of 2 injections. Today, what I'm going to be giving is 5 milliliters LA200 subcutaneous today, and then in not tomorrow but the next day I'll give another shot just as a prophylactic. So we're going to do a couple things with this animal. We're going to make an incision to drain the abscess. After the abscess is drained, I'm going to flush the abscess with iodine, and then I am going to give her an injection of antibiotics, and I will keep up on her and check on her as time progresses. Because of the location of this abscess, I am 100% sure that it is not CL, and we will see that when it comes out. CL, we have a video on CL, you can see it here. CL infects the lymph nodes and will occur, the abscesses will be very they're very distinct if you learn how to identify them, and they're located on the lymph nodes. This is not located on a lymph node, and when we start draining this, I'll show you the drainage and show you how you can identify within reason if it is CL or if it's not. So with that being said, let's head over, take a look at our animal, and go over this together. All right, so here we are. We've got our sheep here, and she has a huge pocket here of an abscess that is formed from a hematoma that she had that got infected. And so what we're going to do is we're going to drain this, we are going to flush it, and we're going to clean it. So when you're cleaning an abscess, I want you to think about gravity. I want you to think about the way that that abscess is going to naturally want to drain. Now, obviously, in this case, I want to make my incision way down low because that way, if it drains, it's going to want to drain out through that hole down low. I would never want to make my incision way up high because there's nowhere for it to go. Again, This is definitely not a CL abscess. CL would be up here in the front. It doesn't look like a CL. It's not shaped like CL. And she's in a lot of discomfort. So what I'm going to do today is I'm going to drain this. I'm going to go to an area where all the other animals are not going to be. I'm going to drain this. And then I am going to flush it, and then I'm going to give her some antibiotics, and we're going to keep an eye on this. This may work, this may not. If this does not work and she becomes filled back up again or has additional problems, I may need to put in a drain, which would be more advanced than most of you would need to do. In your case, you would want to contact your veterinarian. So with that being said, if you have a weak stomach, if you don't like funky smells, and when I say funky, I mean really, really nasty smells, this is definitely not for you. Do not attempt to do this on your own. You will vomit all over the place. So with that being said, I'm going to go ahead and get started. This is a great time for those of you that are a little squeamish to step out, go have a cookie and a nap or a cup of coffee, or call your buddy or call your mom, and for the rest of us, we're going to get started. So what I'm going to do is I'm going to grab my scalpel here. Now my scalpel is already clean. It's already surgically clean. I just unloaded it out of the package. Scalpels are extremely dangerous. Do not cut yourself, do not stick yourself, especially with the bacteria and the nastiness that is going to be coming out of this. When you go through, you're going to feel yourself go through the skin, and then you're going to feel yourself go into a capsule. You're actually going to feel a pop. It's going to feel like a pop going through the skin and a pop going into the capsule. The animal is going to feel very uncomfortable at first, but then once the pressure starts to become more of a relief for them, they're going to feel a whole lot better. So I like to take my blade and bring my blade up towards me. And I like to keep my hands as far away from this as possible. So I'm going to go down low. I am going to make sure my finger is out of the way, and I'm going to make an incision watching my fingers. So I'm through the skin, I can feel that I'm through the skin, and now I'm into the capsule itself. And now I'm going to basically do my best to start draining this out. You don't want to squeeze until... Tessa, will you take the scalpel for me? No. You don't have gloves? Okay, you can't take it without gloves. So bring your bucket over here so I can put it in the bucket. Okay, this smells really bad. You doing all right there, camera lady? Okay, my camera lady says yes. So this is very runny and very clear. This is not typical for a CL abscess. A CL abscess, for those of you that have dealt with CL, you know that CL is very thick, almost like toothpaste, and CL tends not to have any smell. So I'm going to have to palpate this entire wound with my hands and make sure that I empty out as much of this as I can. So she has a huge cavity in here. So she was definitely not feeling good at all. So while, you know, I understand it's uncomfortable and you want to get done with this as soon as you can, the reality is you need to take your time and get as much of this out of there as you can. I'm just trying to feel bilaterally in here and see if I can tell how much muscle damage she has, if it's really gotten into that muscle. This is really bad. You can see there's still some up in there. Okay. So we have that drained out fairly well. The cavity to me feels like it's fairly empty. Okay, go ahead and move her forward a little. So you can see what a large amount we got out of there. So now what I'm going to do is I'm actually going to take my iodine and I am going to flush this with iodine. So what I'm going to do is I'm going to start up high and I'm going to inject into the pocket of this abscess. And I have 60 mLs of iodine on a 14 gauge. Now I want to get through the skin, but not into the muscle. Okay, so once I'm in, I can fill all this area up. With the iodine solution. And you can already see we've got some iodine slowly coming out. And that iodine will slowly continue to drain. Some of it will stay in there, some of it will drain for a bit of time. So now we're just going to let that gravity drain. I am going to refill my syringe, stick her again over here, and that is very uncomfortable for her because this is a really big needle. Pay attention to your partner, watch your partner, have your partner watch you. Okay. And again, that's just going to naturally drain out of there. You want to trade me sides? So at this point, I'm going to give 5 milliliter subcutaneous of LA200. So I'm going to come up over here, over the ribs if you want to come around. So I'm going to go over the ribs down here, pull up some skin. Being careful not to stick myself into the skin. And that's it. I'll do that again in about 1 day. I'm going to go ahead and take my wound spray, spray the wound area really well. And that is it. So I don't do a lot of editing, and I don't use cue cards, and you guys know that. And although I do tend to ramble at times, I'm trying to give it to you in real time and reality instead of doctored up video business. So a couple things happened while I was doing that, and that's important. Someone has to be in charge when you're doing this. Someone has to be running the show, and it always helps to have a helper. I've got my helper over here. You can see her holding my supplies. I've got my wife up here holding the animal, and then we've got Lindy holding the camera. As you know, being in charge, it's important for you to call the shots and to keep everyone's safety in mind. You have to know where the sharp objects are. You have to know what the animal's doing. Tessa instinctively went to grab the scalpel without a pair of gloves on. I had to tell her, hey, no, you know, don't touch that. It's got some bad stuff on it, whatever. You know, you have to pay attention, and you have to have situational awareness when you're doing things like this, especially with, you know, bacteria and sharp things and things that can hurt people. You have to stay calm. You know, this is not a time to argue, fight, yell, do things like that. Just be cool, like Fonzie, as I always say, and do what you need to do and get it done. Accidents are going to happen, things are going to happen. You know, Jocelyn's doing her best to hold the animal, but the reality is that animal is very, very strong, and she's not going to stand in one place. So, you know, if she's doing the best she can do and that animal moves, and I just have to move with her. Again, it's not perfect, and we're not running a perfect farm here, and we know you're not either. So with that being said, I am Tim from Linessa Farms, Specialty in Heirloom Livestock. Thanks for joining us again today, and I look forward to seeing you again next time.